Do one or both of your hands go numb and tingly? Do you wake up at night with one or both of your hands numb or tingly? If so, you likely have carpal tunnel syndrome, which is the subject of this video. In this video, I'm going to talk about what carpal tunnel syndrome is, what can cause it, the treatments for carpal tunnel syndrome, how to know if numbness and tingling in one or both hands is due to something other than carpal tunnel syndrome, and how carpal tunnel syndrome, which will rarely qualify a person for disability on its own, can help with the disability application. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, in order to describe carpal tunnel syndrome, I have to talk a little bit about the anatomy of the nervous system. So, of course, the brain is in your skull, and the brain receives information from your nerves, such as what your hand feels. Is it hot or cold, soft or hard? And the brain also sends commands to your muscles to move your muscles, such as when you want to straighten out your fingers or bend your fingers. Your brain is connected to your spinal cord, which runs down the back of your spine, and at each bone level it sends out nerve branches. The nerve branches from the lower neck and the upper back form what's called the median nerve. The median nerve first is in a complex of nerves that runs down to the armpit called the brachial plexus, and then it separates from the brachial plexus, goes down the front of the arm, and then through a space here in the wrist called the carpal tunnel. The carpal tunnel is composed of bones and a ligament that goes from here to here, and it contains several tendons that bend the fingers and the median nerve. The median nerve goes on to supply the feeling to this side of the thumb, index, middle, and this half of the ring finger. It also supplies the muscles of this, what we call the thenar eminence, which is necessary to bend the thumb like so. It also supplies two muscles in the hand called the first and second lumbricals, which are involved in bending the fingers like so. But for this talk, the lumbricals are not that important, so that's all I'm going to mention them. The other half of the ring finger and the entire little finger get their feeling from a nerve called the ulnar nerve, which does not go through the carpal tunnel. And most of the back of the hand gets its feeling from a third nerve called the radial nerve, which also does not go through the carpal tunnel. And if you're finding this sort of thing interesting, you might want to subscribe to my channel. I generally put out one disability-related video every week. Now, what happens in carpal tunnel syndrome is the median nerve gets pinched as it runs through this area. And when nerves get pinched, they don't work well. They tend to cause abnormal feelings like numbness, tingling, or burning, and they also don't receive sensory information very well, causing numbness, and also they don't communicate the brain's signals to the muscles very well, causing muscle weakness. In carpal tunnel syndrome, you get numbness of the thumb, index, middle, and one half of the ring finger, and you get weakness of these muscles, the muscles that make the thumb move like that. So what can cause pinching of the median nerve in the carpal tunnel? Well, the most obvious is a fracture of the wrist, where there's swelling and bleeding into the soft tissue. More commonly, fluid builds up in the carpal tunnel and pinches the nerve. That's why people with carpal tunnel syndrome tend to wake up with numb hands. When we're awake and sitting or standing, gravity pulls the excess fluid in our body down, and it tends to accumulate in our feet and ankles, and they swell a little bit by the end of the day. When we lie down in bed, gravity is no longer pulling that excess fluid down, and it distributes throughout the upper body, some of it going to the carpal tunnel, and that can be enough to tip the iceberg and pinch the median nerve. Other causes of carpal tunnel syndrome are obesity, other things that can cause fluid retention, most importantly, pregnancy in women. Women retain a lot of fluid in pregnancy. Diabetes, rheumatoid arthritis, genetics, vibration. For example, motorcycle riders often get numbness in their hands due to the vibration of the engine transmitted through the handlebars. Positions such as typing or holding a steering wheel can bring on carpal tunnel syndrome, or very severe low thyroid hormone called myxedema, which is quite rare in North America, so I won't describe that fully. A pinched nerve feels like when you've hit your funny bone. When you hit your funny bone, you're actually hitting the ulnar nerve at the elbow. So carpal tunnel syndrome will cause similar feelings in the hand. Uncomfortable tingling and numbness. And often those tingling feelings will shoot up the arm, often as high as the shoulder. Usually, carpal tunnel syndrome is worse in one hand than the other if it's in both hands, and usually it's worst in one of the fingers. In mild carpal tunnel syndrome, the person only wakes up sometimes with numb hands. Most of the time, the feeling in their hands is normal. In medium carpal tunnel syndrome, the hand or hands are numb all the time, throughout the day and night. And in severe carpal tunnel syndrome, you get weakness of these muscles. And if the weakness persists long enough, those muscles will shrink, what we call atrophy. And instead of having the muscles bulge out, there will be a hollow here at the base of the thumb. Carpal tunnel syndrome is one of the common medical causes of difficulty holding things for two reasons. Number one, it's difficult to hold on to something when you can't feel it very well. And number two, holding usually requires this sort of movement of the thumb, and if that movement is weak, you're going to have trouble holding on to things. Also, unscrewing jar lids can be difficult. Now, one of the types of comments that unhappy hotheads often leave on my channel is that I can't possibly comment about or treat patients with a condition that I haven't had myself. And when you think about that, that's kind of ridiculous. If every physician could only treat patients with conditions they've had themselves, it would be very difficult for patients to find physicians. As an example, I've never had a heart attack, but I've treated many patients with heart attacks. Likewise, I've never had appendicitis, but I've treated loads of people with appendicitis. I certainly haven't been pregnant or in labor, but I've delivered 117 babies, all of them with the mother and infants healthy. And to be more prosaic, I've never even had an ear infection, but I've treated hundreds of people with ear infections. But like most angry comments, these people do have a point. One of the things that I always wondered about carpal tunnel syndrome is that most people with it will tell me that their entire hand goes numb. And I always thought, how could that be when really this part of the ring and the entire little finger don't really go numb? Well, several years ago, I began to have very mild carpal tunnel syndrome, usually in my left hand, only when I woke up at night every once in a while. And what I noticed is when I first woke up, I did think that my entire hand was numb. Being a doctor, I decided to test it and tested the feeling on both sides of each finger. And it was only when I did that that I noticed that this part of my ring finger and both parts of my little finger had normal feeling. My entire hand wasn't numb, although when I first woke up, I thought that it was. So, how do doctors diagnose carpal tunnel syndrome? Well, it's mostly what we call a clinical diagnosis. It's mostly diagnosed based on what the patient tells the doctor and what the doctor finds on the exam. And when the doctor does the exam, they look for atrophy of these muscles. They test the feeling in each finger. And then there are three what we call provocative tests that can cause the symptoms of carpal tunnel syndrome if the person isn't having them at the time of the exam. The first is called Tinel's test, where the doctor taps on the carpal tunnel. And if it's positive, the person will feel numbness and tingling in the fingers supplied by the median nerve. The second is called Phelan's test. The doctor has the person hold their hands like this for 2 minutes by the clock. That pinches the median nerve in the carpal tunnel, and you look for numbness, tingling, and burning in the hands after you've done that test. And the third test is called Durkin's test, where the doctor presses with their thumb firmly on the carpal tunnel for 30 seconds and sees if that produces similar symptoms in the patient. In a person without carpal tunnel syndrome, all of these tests will be negative. Now, what else can cause numbness in the hand or both hands, and when is the situation confusing? Well, anything from a problem in the brain, the spinal cord, the spinal roots, the brachial plexus, or the median nerve as it runs down anywhere in the arm can cause numbness in one or both hands. Let me go through those one by one. If there's a problem with the brain, usually the person has numbness and weakness on one side of the body. That will involve the arm, the entire arm, and the entire leg, and often the face. That's in contradistinction to carpal tunnel syndrome, where only the hand is numb, and if there's weakness, it's only the thumb. None of the other muscles in the arm are weak, and if there's any numbness or tingling or weakness in the legs, it's something other than carpal tunnel syndrome. When there's a problem in the spinal cord, we usually get loss of feeling and or weakness on both sides of the body, involving the entire body from the neck down. That would be both arms, the chest, the abdomen, and both legs. When there's a problem in the brachial plexus or the median nerve above the carpal tunnel, you tend to get numbness, tingling, and weakness in the hand, but also above the wrist in the arm. So if you think you have carpal tunnel syndrome, but you have any numbness or weakness in your legs, or if you have any numbness or weakness in your arm above the elbow, it's something different. In most cases, no tests are necessary to diagnose carpal tunnel syndrome. But if the situation is confusing, there's a type of test called a nerve conduction test that can be done, which is very helpful to tell where the problem with the nerve is. Is it in the carpal tunnel, or is it in another location? So, suppose you have carpal tunnel syndrome. What can you do? Well, the first thing to do is to get a carpal tunnel splint. And here's my carpal tunnel splint, and in a moment I'm going to show you how it works. If you've got carpal tunnel syndrome, every time you move your wrist like that, you aggravate the pinching of the nerve. So you want to hold your wrist in one position. And here is my splint, and you can see I have very little movement of my wrist. I have full movement of my fingers and thumb. I can pick up and hold things. Unfortunately, I see people come in with all sorts of incorrect splints for their carpal tunnel syndrome. For example, recently I saw a person with a splint that immobilized their thumb. There is absolutely no reason to immobilize the thumb with carpal tunnel syndrome. Doing this has no effect on the median nerve as it passes through the carpal tunnel. Likewise, I've seen people with their fingers immobilized. Same thing. Moving your fingers has no effect on the median nerve in the carpal tunnel. You want a splint like this. I'm going to leave a link in the description to this video below to the splint that I have, which I got from Amazon.com. If you only wake up at night with numb hands, then I would recommend you only use the splint when you go to bed. If your hands tend to be numb in the day and night, then I would recommend that you wear the splint 24 hours a day, just removing it when you're going to bathe or wash your hands. In many cases of mild carpal tunnel syndrome, that's all you need. For example, it's all that I need. If that doesn't relieve the problem after a couple of weeks, an injection of cortisone, which reduces swelling into the carpal tunnel, will often bring relief, sometimes permanent, sometimes temporary. If you've tried splinting and cortisone injection and you're still having trouble with hand numbness, or if you have severe carpal tunnel syndrome with weakness of thumb movement or atrophy of the thumb muscles, you are likely a candidate for carpal tunnel surgery. In carpal tunnel surgery, the doctor makes an incision here and cuts the ligament that goes across the carpal tunnel in half. The ligament springs apart, and all of a sudden there's lots more room in the carpal tunnel, and that relieves the pressure on the median nerve. It's a very minor operation. It's usually done with local anesthetic, with Novocaine, and you can go home the same day. You want to have the operation before the nerve has been pinched too long. Nerves that have been pinched hard for a long time tend to die. And once a nerve is dead, relieving the pressure on it won't help. So I suggest that anybody whose hands are numb throughout the day and haven't gotten relief with a couple of weeks of splinting, and especially anybody who's got weakness of thumb muscles and or atrophy of the thumb muscles, speak to a surgeon who does carpal tunnel surgery and get their opinion. Finally, carpal tunnel syndrome is one of the two most common neurological problems that I see in disability patients. The other is diabetic sensory neuropathy. Diabetic sensory neuropathy tends to cause numbness and uncomfortable tingling, beginning in the toes and then spreading up the legs, going to the feet, then the ankles, then the calves. Only when it's spread to the calves do people tend to get some numbness in all of the fingertips and both of the hands. As I said before, carpal tunnel syndrome does not cause any problems with the feet. So if you've got numbness in your toes or feet, something else is going on besides carpal tunnel syndrome. Remember that 3 of the important work-related abilities Social Security considers for disability are the abilities to lift, carry, and handle objects. If you have numbness and or weakness in one or both hands, you're going to have limitations on your ability to lift, carry, and handle objects. And that can contribute to a disability claim and may be the factor that gets you approved. So if you're experiencing those sorts of problems, you want to tell the doctor and Social Security about it. You want to tell them how often are your hands numb. Is it only when you wake up, or is it throughout the day, or is it when you're typing, for example? And then you want to explain how that limits you. For example, do you have trouble carrying things like a pint or a gallon of milk? Or do you have trouble with fine manipulation, such as buttoning a shirt or writing? Like I said, unless it's very severe and in both hands, carpal tunnel syndrome alone will not qualify for a person for disability. But if the person has other disabling problems, carpal tunnel syndrome may be the thing that gets the claim approved. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.